In April and May of 2026, a Dutch cruise ship called the MV Hondius was sailing an itinerary through the remote, icy waters of the South Atlantic. During that voyage, several passengers developed a rapidly progressing respiratory illness. The symptoms escalated so quickly that the ship had to initiate emergency medical evacuations. This chart shows the epidemiological data released by the World Health Organization on May 8th. Out of 8 total cases linked to the ship, 3 people died. That results in a 38% case fatality rate, a lethality that towers over typical respiratory infections. Laboratory testing soon identified the pathogen responsible for the deaths. It was hantavirus. What caused international health agencies to take notice and sent the internet into a frenzy was a specific detail about how the virus was moving. It was spreading from person to person. When a highly lethal virus starts jumping between passengers on a ship, it raises an immediate, terrifying question. Are we watching the prequel to a new global pandemic, or is the public misunderstanding a localized medical anomaly? The phrase cruise ship outbreak carries a lot of cultural weight. It instantly triggers memories of early 2020, when ships became the early incubators for a global crisis. Because of that experience, there is a common assumption that any virus capable of spreading from one human to another automatically possesses the mechanical ability to circle the globe. To determine the actual threat level here, we have to look past the sensational headlines. We need to deconstruct the specific biological mechanics of this unique virus. The baseline biological rule for hantavirus is that it is an environmental pathogen. It circulates asymptomatically in populations of wild rodents, like deer mice, and is rarely a human problem. This diagram shows the normal transmission vector. People typically contract the virus by inhaling aerosolized particles from dried rodent waste, like when sweeping a cabin. Under normal circumstances, human infection is a biological dead end. The virus lacks tools to jump hosts. So how did it spread on the MV Hondius? Before boarding the ship, these passengers spent time in Argentina, where they were likely exposed to infected rodents in the local environment. The exposure involved the Andes virus, a specific South American strain that stands as the singular biological exception in this family. It is the only hantavirus known to transmit directly from person to person. This strain causes a condition called hantavirus pulmonary syndrome. Once inhaled, the virus attacks the pulmonary system, causing the capillaries in the lungs to rapidly leak fluid into the surrounding tissue. Patients essentially drown in their own fluids. Yet the Andes virus has a crucial biological constraint. Unlike highly airborne respiratory viruses that can linger in a grocery store aisle, the Andes strain requires prolonged, intimate contact. Transmission is usually strictly limited to people sharing a bed or healthcare workers providing close, sustained care. A shared cruise ship cabin serves as the perfect incubator for this kind of close contact transmission. However, the virus remains biologically unequipped to trigger rapid, widespread community spread. Once the cluster was identified, the international response was aggressive. Passengers were medically evacuated, some utilizing bio-isolation pods, and placed under strict quarantine protocols. Health agencies spearheaded contact tracing efforts. They mapped the itineraries of all 147 passengers and crew, tracking anyone who might have been exposed as they returned to their home countries across the globe. After reviewing the transmission data and containment measures, the CDC and the World Health Organization delivered a unified verdict. The risk of widespread transmission to the global population is considered extremely low. A low pandemic risk does not erase the trauma of the event. For the individuals infected on that ship, the disease was devastatingly real and highly lethal. But for the average person watching the news, the true statistical threat doesn't come from another person on an airplane or a cruise ship. It comes from standard environmental exposure in rural areas, near your own home or cabin. The preventative actions remain the same as they have been for decades. If you are opening a closed space, ventilate it safely before entering. Wear gloves and a mask, and avoid direct contact with rodent droppings or nesting materials. The Andes strain is a deadly biological anomaly that deserves deep medical respect. The 2026 cruise ship cluster is a contained tragedy, but the mechanics of the virus ensure it is